Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Introduction: Organophosphates, OPs, are a class of chemicals commonly used in agriculture, pest control, and even medicine. While they have proved valuable in various applications, they also pose a significant health risk due to their potential for poisoning. Organophosphate poisoning occurs when these chemicals disrupt the normal functioning of the nervous system, leading to a range of symptoms and potentially life-threatening consequences. This video explores the causes, symptoms, and treatment of organophosphate poisoning, shedding light on the importance of understanding and managing this toxic exposure. Causes of organophosphate poisoning. Organophosphate poisoning primarily occurs through exposure to substances containing these chemicals. Common sources include insecticides used in agricultural settings, household pesticides, and even certain medications. People can be exposed to organophosphates through inhalation, ingestion, or skin contact, with agricultural workers, pest control operators, and individuals handling these chemicals being at higher risk. Mechanism of toxicity. Organophosphates exert their toxic effects by inhibiting the enzyme acetylcholinesterase, which is responsible for breaking down the neurotransmitter acetylcholine in the nervous system. By interfering with this enzyme, organophosphates lead to an accumulation of acetylcholine at nerve synapses, causing overstimulation of both the central and peripheral nervous systems. This overstimulation results in a wide range of symptoms affecting various bodily functions. Symptoms of organophosphate poisoning. The symptoms of organophosphate poisoning can vary in severity and can manifest within minutes to hours after exposure. Common symptoms include 1. Muscle weakness and twitching. Increased acetylcholine levels lead to muscle twitching, weakness, and cramps. In severe cases, this can progress to paralysis, which may include respiratory muscles, potentially leading to respiratory failure. 2. Excessive salivation and sweating. Overstimulation of the salivary and sweat glands can result in excessive salivation and sweating. 3. Dilated pupils. The pupils of the eyes may become dilated due to disrupted nerve signals. 4. Nausea, vomiting, and diarrhea. Gastrointestinal symptoms are common and can contribute to dehydration and electrolyte imbalances. 5. Respiratory distress. Severe cases of poisoning can cause respiratory distress, including difficulty breathing and eventually respiratory failure. 6. Confusion and anxiety. The central nervous system effects of organophosphates can lead to confusion, anxiety, agitation, and even seizures. 7. Cardiovascular effects. Heart rate and blood pressure may be affected, potentially leading to irregular heart rhythms. Treatment of organophosphate poisoning. Prompt and appropriate treatment is essential to prevent serious complications and death in cases of organophosphate poisoning. The following measures are typically taken. 1. Decontamination. Remove contaminated clothing and wash the skin thoroughly with soap and water. Inhaled or ingested chemicals should be flushed out as well. 2. Supportive care. Maintain the patient's vital signs, provide oxygen therapy if necessary, and manage seizures if they occur. 3. Antidotes. Administering antidotes like atropine and pralidoxime helps counteract the effects of organophosphate poisoning. Atropine helps control excessive secretions and reduces some of the nervous system overstimulation. Pralidoxime reactivates acetylcholinesterase, helping to restore normal nerve signaling. 4. Hospitalization. Severe cases require hospitalization, particularly for close monitoring and potential ventilatory support. 5. Follow-up care. After the acute phase, patients may require ongoing medical care, rehabilitation, and psychological support. Conclusion: organophosphate poisoning is a serious health concern resulting from exposure to chemicals used widely in various sectors. Understanding its causes, mechanisms, and symptoms is crucial for prevention, early recognition, and effective management. By promoting awareness among individuals who handle organophosphates and within the medical community, we can take steps to mitigate the risks associated with these toxic compounds and ensure a safer environment for everyone.